Good morning, everybody. Thank you for joining us. Welcome to the February 9:30 call. We are so glad you're here and that you've decided to start your week with us. February might be the shortest month, but it's a big one for early childhood in New Jersey. Budget season is in full swing. Policy conversations are picking up, and decisions are being made right now that will have real implications for providers, families, and the workforce. As always, this call is about keeping you informed, connected, and engaged, whether that means understanding what's happening at the State House, hearing what others across the state are experiencing, or knowing when and how to use your voice. Just a little housekeeping. These calls are now recorded to be shared as a resource afterwards. Please keep your microphones muted out of respect to the speaker and to avoid any unnecessary distractions for your colleagues. And we thank you for that in advance. We do have a full agenda today, including a new Head Start update, space to share what you're seeing on the ground, and a look ahead at what's coming next. So let's jump in and make the most of our time together. I'd like to introduce our guest speaker, Rita Koromi from the Office of Child Care at the Division of Family Development, New Jersey Department of Human Services. You may have heard about the Shared Services Alliances. The membership-based alliances are typically housed within the Child Care Resource and Referral, or CCR&R agencies, and they offer tailored services to meet the unique needs of each community. And I'm going to pass it over to Rita to tell us some more.
Good morning, everyone. Thank you, Cindy. As Cindy said, my name is Rita Koromi. I'm here from the Department of Human Services, Division of Family Development. And I'm so happy to be here today and present on the overview of the Shared Services Project, which is a collaborative project between DFD, NJAEYC, the local CCR&Rs, and also early education business consultants. So I will be joined for today's presentation by Amanda DiScala from NJAEYC, Lauren Small from Early Education Business Consultants, Alison Chervier from Shared Services Coordinator at Child Care Connections, representing Mercer County, Liz Builder, Shared Services Coordinator at Community Child Care Solutions, representing Somerset County. So as we move through the presentation, I'd like to invite you to pay particular attention to the testimonials that are included on each slide. These testimonials were collected from providers that are currently part of the project, and we believe that it offers valuable insight into the impact of Shared Services Initiative. So let's get started. Today, we are going to give you a high-level overview of New Jersey's Shared Services Initiative and also why it exists. We'll start with a brief look at the initiative purpose and the problems that is designed to solve. Then we'll look at the map and of Shared Services Alliances across the state and explain how it is connected to the network. We'll also talk about the infrastructure, how it supports the work, and how the logic model helps us to keep focus to make progress on the systematic business challenges. Then we'll take a look at some focus areas, some early accomplishments, and opportunities ahead. And towards the end of our presentation, we'll focus on what's next and how providers and programs can get involved. So first, we'll talk about the overview and purpose. Shared Services is part of a national movement spearheaded by Louis Stoney at Opportunities Exchange with a simple but very powerful message, which is strengthening the business model for early care and education. This model brings providers together in a formal collaborative structure so they can achieve efficiencies that most of the time really difficult to do by themselves. In New Jersey, this work operates as a statewide network with 16 CCR&R housed Shared Services Alliances. These alliances connect and support early care and education providers. The providers join, they meet regularly, and their focus is to strengthen their businesses and improve program quality. Their participation is membership-based. Programs apply and commit to active engagement, regular attendance, and shared decision-making.
Okay, you may not get.
Key strength of shared services in New Jersey is that each alliance is developed in response to a unique need of their local community. Another key strength of shared services work is that these services are offered both in English as well as in Spanish. Alliance work is intentionally focusing on the strengthening business operation. This includes the strategic planning, human resource management, financial management, marketing, and the effective use of technology. Collaboration and shared resources are central and critical to this work. By pooling resources together, such as shared staffing, tools, and systems, programs can reduce expenses, save time, and operate more efficiently. Are we okay moving forward, Fiona?
Yeah, sorry, hold on.
Sure. Just want to make sure that we still have the PowerPoint sharing. So as I mentioned, collaboration is critical. Providers, they realize through this process that they are not alone, and being part of a supportive network really helps them to achieve long-term success. A critical component for shared services is the direct support that they receive from the alliance coordinators. As we mentioned prior, coordinators are housed at the local CCRNRs, and they provide intensive and hands-on support. Okay. Over time, these efficiencies add up, and the ultimate goal is the business sustainability, which really connects with higher quality practices and freeing up time for providers to focus more on pedagogical leadership, which again connects directly with better outcome for children, families, and the communities. So on the next slide, we'll look at where shared services currently at New Jersey. So you see a list of counties that are currently involved with the work. You can see also on the slide that we currently have 138 active members across New Jersey in the 16 counties. I'd like to highlight that during the most recent fiscal year 25, we had 21% increase in membership. We started with 114 providers, and currently we are at 138, and the number is constantly growing, which is super exciting. I also would like to highlight that the 4 counties that the highest number of increase in the last fiscal year, which was Passaic, Somerset, Hudson, and Essex. On the next slide, Allison will be walking us through the New Jersey Shared Services Alliance building blocks. Allison?
Thank you, Rita. For a shared services coordinator, there are several steps to building a successful alliance. Advisory boards are voluntary groups of community members who help strengthen alliance members' businesses by providing advice or connecting coordinators with various resources. Advisory groups meet quarterly and comprise members from industries such as marketing, insurance, and finance. Ideally, the advisory board is formed first so it can participate in alliance member selection. Provider recruitment is conducted through newsletters, flyers, and email blasts highlighting alliance accomplishments, hosting information sessions, and participating in partner meetings such as this one today. Prospective alliance members complete an application and may be asked to attend a membership interview to discuss participation expectations. Most alliances meet once a month. Busy providers tend to prefer virtual meetings, but in-person meetings are included as well to help build trust and strengthen the group dynamic. A typical meeting lasts 1 to 2 hours and includes networking, training, and support on challenging issues from members and their coordinator. Each quarter, coordinators gather data. While each alliance has different needs and goals, we all collect data on enrollment and staff turnover. These metrics are compared quarter to quarter to track
Allison, you're muted.
Sorry about that. Alliance coordinators are connectors. We source articles and websites, secure grants, and arrange guest speakers based on members' needs, interests, and goals. Finally, each coordinator creates a strategic plan for their county's alliance that details the established goals and steps to achieve them. Doing so helps the coordinator assist their members in creating their own strategic plans and achieving their goals for improved business sustainability. I'm going to turn it over to Lauren, and she's going to go over the logic model.
Thank you, Allison. This slide will help clarify the methodology we are using to design the framework of our alliances, which this framework also helps us achieve our statewide strategic plan, as well as the individual alliance strategic plans that Allison just mentioned. So New Jersey Shared Services uses a logic model framework to visually illustrate the intentional approach we have taken to designing shared services and basically how we carry out the work. Understanding that our goal is supporting childcare providers to achieve positive, long-lasting results. So if you're not familiar with logic models, they're just a simple way to visualize complex relationships, which is particularly helpful when building something new. So logic models look at the relationships among resources, people, organizations, activities, and ultimately what we're trying to achieve, intended outcomes. So think of it like a roadmap. It shows how we move from planned work to desired results and provides us with that structure, that clear structure for planning, evaluation, and even our communication among all our stakeholders. So on this slide, you'll see 4 key components of our New Jersey Shared Services logic model. We simplified it. You should have seen it in the beginning. It was very complex. And so the first component you see there is observed challenges. And what that means, it refers to the real business challenges that our alliance members are expressing to us. They share this in a confidential, supportive environment. So we learn about our members' needs through alliance meetings. They meet monthly at a minimum. Through surveys, we've even had focus groups. And these challenges are identified directly by the providers based on their lived experiences running childcare programs. And I think everyone on this call understands those challenges that have been expressed. Then, in the second block, before a shared services coordinator jumps into offering solutions or coordinating support, our model intentionally brings in data. And we have kind of 2 buckets of data that we're collecting and analyzing. First, we assess members' business practices. We want to see what's working well and where there may be gaps existing. Then the second bucket, like again, Allison mentioned, is that we also collect and analyze business metrics, like employee turnover rates, as well as employee turnover rates. And this allows us to take more meaningful, deeper, more informed look at our industry-wide challenges. So once we understand both the challenges and the data, we move into action. We move into actual shared services. And at this stage, coordinators work with their alliance members to identify and deliver the most appropriate shared services and supports. And that looks like direct support, coordination, connecting, business training, business coaching. Our coordinators also meet at least twice a month to discuss results, learn from one another, to collaborate and discuss any barriers that they may be experiencing. In just a minute, we'll give you a clearer picture of what shared services looks like in practice. But all of this is leading to the final component, solutions that lead to stronger outcomes and impact. Our ultimate goal is to support high-quality early childhood education by deepening our focus on business sustainability. And we recognize that when early childhood leaders have strong business practices and the right business infrastructure in their programs, such as systems for staffing, finances, operation, decision-making, when they have these in place, they're more stable. And this stability directly supports higher quality care and education for the children. So next, we're going to jump into highlighting core services, and Amanda will take over to talk about the platform.
The New Jersey Shared Services Platform is one of the focus areas for our shared services work, and it's to the logic model that Lauren was just talking to you about on the previous slide. So we work through the platform with the coordinators, with our alliance members as they design solutions, develop their shared services, and guide their work in creating solutions as a team. The New Jersey Shared Resources Platform is operated by NJAEYC, and access to the platform is a component of Alliance membership. So if you are not using the platform when you join an Alliance, you receive access to that platform and training on it. We collaborate with the coordinators and Alliance members to use the thousands of resources, tools, and materials in the work towards their common goals of saving time, saving money, improving quality, and the goal of sustainability of overall programs. So the resources in the platform are curated into 5 categories. Our newest category is called New Jersey Resources. Within that category, there's a section, a page, a group of pages that is dedicated to each Alliance network. So you can learn what they're working on, their makeup, and how to contact them for more information. There are other resources in this bucket as well that we are calling local New Jersey resources. And here you can find resources that users and Alliance members have asked for or requested over time, such as grant writing resources, the advocacy toolkit, the infant toddler toolkit, and more. One of the new areas that this team has been working on is to prepare and soon pilot a substitute platform, which will be a benefit of Alliance membership. Other resources and materials are collected into 4 other categories. One being engaging families, and these are resources that you would use for family engagement within your program and towards those goals. In the classroom is materials that you would use within your classroom, such as templates for parent-teacher conferences, classroom labels, shelving labels, and materials such as that. The saving money category holds many resources for cost-saving programs, additional resources for insurance, business insurance, dental and vision, and other health insurance, and other materials for cost savings. And then our biggest bucket and the most used area is the successful program management section, which holds our most used resource, Acquire for Hire, which is the free job posting site that allows users to post to 10 outside sources with no cost to them. The Becoming an HR Expert, which is resources and templates for recruitment and retention, and many more templates and resources for handbooks, strategic planning materials, and templates for policies and procedures. So we work to connect the alliances with these resources on the platform to make their work more efficient and to support them in reaching their goals. On the next slide, Liz is going to share some of the work and the focus areas that our alliances are working on.
Great. Thanks, Amanda. Here are some examples of our recent focus areas. The Child and Adult Care Food Program is a federal program providing reimbursement to eligible providers. The Alliance helps educate and improve access for members. Several counties have already managed successful teacher substitute pools, and as Amanda just mentioned, Shared Services is piloting a statewide substitute pool to be rolled out later this year. Stay tuned. The Alliance may support providers by screening candidates, attending job fairs, and offering guidance on hiring best practices. Get Covered NJ is a state-based health insurance marketplace offering affordable coverage. Alliances have scheduled information sessions and facilitated local one-on-one assistance, resulting in reduced monthly premiums and out-of-pocket costs for childcare providers and their staff members. Shared Services coordinators work tirelessly to find grant opportunities for their members, funding initiatives like summer interns, classroom pets, and receiving free essential supplies. Alliance members have received extensive business training, resulting in increased confidence, productivity, and professionalism. We find, recommend, and secure excellent training tailored to the specific needs of the Alliance. We identify a wide range of resources to help Alliance members navigate challenges and stay informed about industry trends, developments, and innovations.
Coordinators also network with local business communities and quality supports within CCR&Rs and Grow New Jersey Kids. From evaluating websites, curb appeal, and social media presence, to helping with Google reviews, testimonials, and advertising campaigns, this kind of support strengthens the financial outcomes for Alliance members. Again, it is important to recognize that each Alliance is different and focuses on the areas that are relevant and of interest to its members. Now, back to Lauren.
Thank you, Liz. So we're still relatively new as a statewide shared services initiative, but we're already seeing incredible results of our work. It's only been within the last year that we've been collecting shared data metrics across all alliances, giving us an opportunity to further see our impact. So these data points represent early but meaningful indicators of progress and help us understand trends, guide our work, and strengthen our support to providers. The impact of shared services is being noticed across the industry. And as Rita mentioned, Alliance membership continues to grow. She mentioned that 21% growth that we experienced from quarter 2 to quarter 4 last year. And this growth reflects increasing awareness of shared services and the growing trust in the value alliances provide to childcare programs. You also see here 109%. We experienced 109% increase in awareness of our members of the Child and Adult Care Food Program, which is one of our core services that we offer. And this just means that the number of Alliance members who are eligible for the food program and who have a deeper understanding of its benefits and how to apply, that understanding and awareness more than doubled during the time period. We know that increasing awareness is a critical first step towards accessing this important reimbursement resource. One of our statewide goals this year for Alliance work is to support our members in increasing enrollment. We measure this by looking at enrollment as a percentage of licensed capacity. It's actually a complicated calculation when you take into account full-time equivalent as well as preschool expansion, how that affects capacity. So currently, Alliance programs are operating at an average of 71% of licensed capacity. So that's one of our targeted goals, is to increase that number and provide support around that. Collecting this data, though, is so powerful because it gives us a clear baseline data point with that opportunity for continued growth. Another key statewide goal is to ensure that all of our Alliance members have a strategic plan using the SMART goal framework. Strategic planning, regardless of business size, is a powerful tool for driving long-term sustainable business change and growth. So again, last year from quarter 2 to quarter 4, we saw 112% increase in completed strategic plans, meaning that the number of our Alliance members with a strategic plan more than doubled in just 2 quarters. So we see so many opportunities for shared services moving forward. And as we look ahead, this slide shows you some of the key opportunities that will help strengthen the shared services model and deepen our impact statewide. So one opportunity is the data. We want to improve consistency in our data reporting across all of our alliances. So as our network continues to grow, having clear, reliable, comparable data will help us better understand those trends, measure our impact, and make informed decisions. We've done a lot of work to ensure that the New Jersey Shared Services coordinators are collecting the same data points and calculating them in exactly the same way. We also see an opportunity to expand the NJAEYC Shared Resources platform that Amanda discussed. As she mentioned, this powerful platform allows us to share tools, templates, and resources more efficiently and ensures that Alliance members have easy access to high-quality, up-to-date materials. We are also really, I would say, pushing the platform to be as New Jersey specific as possible with continued customization efforts like housing our subpool technology there. Another priority is to increase the use of strategic planning with SMART goals. Our goal is for strategic planning to become an annual best practice for our Alliance members, and which supports that continuous improvement and that long-term business sustainability that we mentioned, helps establish business goals. Our coordinators provide the support, structure, and accountability for this important business practice. Increasing enrollment as a percentage of licensed capacity remains a major focus for us this year. Moving forward, we will provide even more targeted support to Alliance members to help them address enrollment challenges, thereby strengthening their financial stability. Improving access to the core services that we offer. While shared services are intentionally designed to reflect the unique needs of each community, we also have a set of core services that are offered across the state to all alliances. And one example we've mentioned is like the food program awareness. So moving forward, we just want to continue improving the quality and consistency of how these core services are delivered. And as new members join alliances, we want to circle back and ensure that there's a clear process that they receive these services early on. We're committed to innovation and continuous improvement. We'll continue to evaluate what's working, strengthen those existing core services, and thoughtfully add new core services that will benefit all Alliance members. The subpool, the statewide substitute pool pilot, is a great example of this evolution, a new core service that's being developed in response to a shared statewide workforce challenge. Finally, we're focused on intentionally growing Alliance membership. By continuing to expand participation, we can increase the reach and impact of shared services while maintaining the quality and depth of support that makes the model so effective. Next, Liz is going to talk more deeply about what Alliance membership looks like.
Thanks, Lauren. We have some requests that we ask of members to set the Alliance up for success. It's important for members to be really present during our monthly meetings, so have their cameras on, no multitasking, etc. We expect everyone to be willing to share their ideas and opinions. Our most productive meetings happen when everyone attends and actively participates. Members are encouraged to be open-minded and to consider new and sometimes unfamiliar ideas to support their growth and professional development. Coordinators work very hard to build rapport and trust within their alliances to help strengthen the collaborative spirit and motivation. Everyone is asked to be accountable, organized, and committed to the Alliance. The Alliance is a safe space where we are respectful of one another and practice discretion and confidentiality. We adopt a team player mentality, and over time, our partnerships have evolved into very meaningful and highly valued relationships. Now, if all that sounds exciting, Allison will tell you how to get involved.
Thanks, Liz. If you would like to learn more about membership in your county, scan this QR code, which will direct you to childcarenj.gov. Under the Providers tab, select Quality Initiatives and Shared Services. From there, you'll be able to select a county and see contact information for the coordinator. And I will now turn it back over to Rita.
Thank you. So as you see, the New Jersey Shared Services demonstrates a powerful collaboration in strengthening early childhood programs, both center-based as well as FCC. This works improve sustainability and really allow providers to focus on what matters the most, which is quality care and education for children. We believe that together in this project, we are building a stronger, more resilient childcare system for New Jersey. So this concludes our presentation, and now we are here for questions if you have any. We try to respond to questions in the chat, but if you have any questions that you would like to come off mute and you would like to ask, we are here to respond. So there is a question about the membership. There is no fee. What is the cost of a membership membership, is there an annual fee? There is no cost to the membership. You have to apply, and there is an application process that has to be completed. And of course, there is a memorandum of understanding that has to be signed by all providers that are joining the work, which includes commitment, time, and also working together with the alliance. But there is no actual membership fee. Any other questions? Oh, okay. Rebecca mentioned that she's using Acquire for Hire platform, and it's great. Acquire for Hire is part of the shared services platform that Amanda talked about. It is a great platform to use for hiring practices. Current application.
Hi. I would like to thank you for this presentation, as always. They're very informative. I am a part of the Shared Alliance, and I use many of the services. It's wonderful. Thank you for that. The biggest challenge, I think, that most of the centers that I speak with that are private, of course, is facing the mixed delivery system, because it's taking many of our students away. Are there any suggestions of how we can get involved with the Alliance to help with this enrollment situation?
That is a challenge. We do realize that with enrollment and the mixed delivery system, and how maybe some children or families are moving to different schools, there are certain things that we cannot control. However, there are the business aspect that we are helping providers to really focus on. Those items that still can and able to strengthen their business practices, which can be different at every single county. I don't believe that there is one magic solution. However, there are components that definitely can be looked at and viewed. Now, I'd like to ask maybe Liz or Allison to provide any feedback from their experiences. Have you came across in your alliance with something similar? And are there any specific suggestions that you may be able to share?
Well, I know that I try to do a lot of reading and stay on top of recent developments. I know that just recently, I think it was last week, a new mixed delivery handbook came out that I did send out to all of my Alliance members to keep them up to date with what's going on. So we just try to stay on top of anything new that's coming out. And we continue to pray and be hopeful that the mixed delivery does gain a lot more traction.
Okay. So there are some questions about how to get involved. That QR code that we shared before is brings you to the state website, and every alliance has a separate section in it, so you are able to find direct contact information for each and every alliance. Thank you, Fiona, for bringing up the QR code. Again, scan this QR code and you are able to find specific information about the alliances. Let me make sure that I didn't miss any other questions.
Rita, I think the questions are probably mixed delivery and CCAP.
Okay.
So I know, yeah, that's really not.
Those are some, right?
Yeah.
We may not be able to specifically offer solutions.
We will be talking about both of those
Okay.
more,
Okay.
as we get
Sounds
through
good.
the call.
Thank you.
Yes. Rita and team, thank you so much for joining us today. We really appreciate your presence on the call and sharing this information. All of this information will be shared after the call in our recap email. So you will have more information about how to join and what the Alliance can provide you with. There was a lot of positive feedback in the chat related to the shared services alliances that people are members of. So thank you always for that support. And related to preschool expansion impact, I know providers have a lot to say about that. And there is a current survey. I did put the link in the chat. So if you have not completed that survey yet, please take a few minutes to click on that and complete that survey. I do know they will be closing it soon. So you only have a day or two to get your input in there about the impact of preschool expansion on your program.
Thank you. Thank you so much, Cindy. If I may just say one word. Wendy, your quote or your message in the chat is really just a perfect closing. Thank you for sharing. You're part of the Shared Services Alliance in Middlesex County, and as you said, it was the best decision you've made. You feel that you're more confident in knowing, and you're just really enjoying the work with the Shared Services Alliance. Thank you so much. And thank you, Cindy, for inviting us. And any other questions that may come in, don't hesitate to reach out.
Thank you, Rita. Thank you, Rita's team.